Who you'll hear today, just want to kind of set the stage. Jordan and Anthony are our software developers that worked on building out the POC. And as mentioned, my name is Mark Laney. So we'll go forward. We have, going to the next slide, Jordan, team of folks that have worked on this. And we actually, some of the information back and forth. Special thanks to the NeuroCode team for helping to provide some information as we work through this. So today what you'll see is our IBM Clinical Development Platform, EDC at its core, with a variety of different modules, unified clinical data management solutions, where we've built the downstream integration with the SDR. And with that, I want to turn it over to Anthony to kind of discuss a little bit on what we're using to do that, and then a little bit more about the use case.
Sure. Yeah. So, for our initial POC, one of the modules that we focused on using within our EDC system is our ODM module. Our ODM module allows us to import CDISC ODM and generate a complete study design from it. So we started to look at what's available in the SDR and the USDM model, and decided to kind of focus on a few key areas, right? The top level, like study data, pulling in and building out a metadata version, which we kind of build that from the workflow item matrix that's available in the data model. And then we take encounters and activities and map those into ODM study events and form study event definitions and form definitions. So we can jump a little bit into the demo here to kind of break these down a little bit more for you and give a good visual representation of that. So with that, I'll hand it over to Jordan.
Yep. So I am. Hello, everyone. My name is Jordan Simpson. I'm a developer at IBM. I am in the context of a single clinical trial in the ICD platform. This is a blank study design at this point, but we've built in the ability to import study designs directly from SDR. So I'm going to load this page. While that was loading, it went to the SDR repository and grabbed a list of all available study designs that we could access at this point in time. Obviously, since there's a full study design created for each update, we have a growing list here, and this is something we could certainly tailor as we continue to grow our knowledge about this system. But I'm going to pick a study that we've been using before to import. I will choose to import that study, and this is going out to the SDR study design repository or study definition repository, pulling down the current version of the JSON that matches this study design, and we iterate over the workflow matrix to define to identify all the activities and encounters that are defined there. What we realized in this specific study is that there are 3 different unique sets of encounter and activity data, as it are all kind of embedded together, but there were 3 distinct sets. So we did create a different revision, or in ODM terms, metadata version for each set to represent that. Within each set, we generate a visit schedule. So this is the 5 visits that were defined in the SDR for this study. The order displayed here does match exactly the order that we see those items in the responding JSON. If I were to select any of the study events, I get a list of all of the corresponding forms that were found in that JSON as well, or in that response as well. And as the goal of our integration here was really to consume directly from SDR, we kind of stopped at the point of generating stubs for the different forms to show that our connectivity works and that we're able to consume the study design that was defined in that area. Certainly, we see opportunities to continue to expand upon this and to bring in more full-featured form definitions in the future. But at the highest level, this is the activities we've found, the sets that made the 3 different revisions or MDVs in our system were found by looking at the unique combinations of previous item in sequence and next item in sequence in the workflow matrix. And from that, as I said before, we did find 3 unique series of events and generated a unique metadata version for each of those. And that more or less sums up our side of the demo today. So it's really just about identifying the study events and based on the encounters, defining the forms based on the activities, and generating a stub of a study design from that content. So, are there any questions on our side?
Dick Patrick has his hand up.
Hi, this is Patrick, yes, from Johnson & Johnson. Can you hear me?
I can, yep.
Yes.
Yep.
Okay, great. So just a quick question. So in my experience, the information in the protocol to the case report forms is not really a one-to-one relationship. So you have, for instance, their exposure or disposition and so forth. We have multiple standards to support that. How do you link that? How do you make it a unique link from your protocol to that particular case report form standard? What information do you use?
So I can pull it up on another screen, but we're at this point, we weren't trying to get too intelligent with how we think the actual uses are, because we believe that that's information that will be more transparent with future releases of the SDR and all work associated with DDF and USDM. But at this point, if you look in the payload that comes back from SDR, there is a sequence of activities that is defined, and we directly consume that without further manipulation. So we were able to pick out the different activities and the names of the forms by just a literal one-to-one mapping from the SDR response.
Okay, great. Thank you.
Any other questions?
I think there's one in the chat. It looks like Robert asked, could IBM pick up the study definitions generated by Trials AI through one/different SDR instance?
So yes, that's certainly possible. If the schedule of activities is defined, we would be able to consume that. I did take a quick look during the demo and did not see a specific study or I did not see the one that Trials AI was generating. So I'm more than happy to pull in a different study as well, but I just didn't see that one in our list as an available option when we were starting to pull this content together.
Yeah, and I just to kind of add, and I don't know if it was could we do it right now or could we do it in general question, but today everything is in one single instance of this SDR. So anything that is available, then it would be available here in this drop down. So you know, whether it's pushed by NeuroCore or Trials AI into here, it would be available in the list. One of the things in the future that, you know, we kind of envision is there's some sort of, you know, where are you going to get the information from, but today it is, you know, here's all the studies, and we just so we're just grabbing one at the moment.
Yeah, for the POC, we have hard coded to the Transcelerate instance on Azure, and are using that key that was generated to authenticate and pull these lists and the designs, or the certificate that was generated for that. As we could see this being productionized in the future, certainly you would need the ability to specify your URLs or URLs and provide a unique certificate to access a other instance of SDR.
And I do think we will see in the next demo, which is the NeuroCore Oracle one, sort of the end-to-end flow of the same study. So I think that's a good lead in. I think there's one hand raised, so if it's a quick question, we can probably take it before we move on.
Sure, I can ask. Can you guys hear me okay?
Yep.
Yeah, I think, I mean, so you're demonstrating that you can access the SDR, which is fine, right? I think as from a user point of view, what we are failing to see is if I am a user and I am in the study design, right? I have a protocol, I'm going to select certain, for example, objectives and endpoints from my study. What I wanted to see is how you in your study designer, based on the objectives and endpoints your protocol require, how you can go link to this SDR, search the SDR for a study that has you know, similar objectives and endpoints, and bring down the metadata that you need into your metadata repository, your study designer, right? That's what we haven't seen so far. At least I haven't seen it. You demonstrate you can connect, and it's fine, but you know, in real life, right? You have a protocol, you have some objectives and endpoints. Based on those objectives and endpoints, you're gonna search this registry and find studies that are similar to your objectives and endpoints that you can leverage that metadata and then pull it down into your shop. And that's what we haven't seen yet.
So in this scenario, though, we do have a known protocol we're pulling from. So that was we are selecting from the protocol that matched the study design we're trying to render for the EDC system.
Yeah, and that's perfectly okay. That's what we have not seen is how your tools, based on the objectives and endpoints of your study, can search the SDR and locate that information in the SDR and make that information available then for selection of what study you really want that matches your parameters, right? That's what we have not seen yet. At least I haven't.
I think that's a great point. As I mentioned, we are going to be doing a connect-a-thon later in the year, and we're actually trying to come up with some sort of example use cases for what folks might want to see in that connect-a-thon. So I think that's one we can definitely note as a potential use case for the upcoming connect-a-thon.
Thank you.
And that's great feedback from thank you for that.